Welcome back to Wave 3 Listens Live. I love when associates in pediatric therapy pay us a visit because you're going to meet two very special patients of the month. This is a beautiful family, and it is a time to celebrate family. We're going to talk about that a little bit with Caroline Scott, who is with Associates in Pediatric Therapy. She's the Director of Marketing. All right, Caroline, I always love when the patients of the month come in because it's about children excelling and being the best they can be, right?
That's right, and this is a special one. This time we have a family of siblings, and it's Autism Awareness Month this month. And so Carrie and Victor are going to share their story through autism with Micah and Aniston, and so this is just a special group here today.
Okay, here's Aniston over here to my right, Micah to my left, Mom and Dad who are very proud. Congratulations. Patient of the Month is really a big deal here because these are kids who really have worked hard to be a better version of themselves. They've overcome challenges. So if you would, tell us a little bit, Carrie, about your story about Micah and about Aniston as well.
So Micah's our firstborn. He's 4 years old, and we knew right off the bat he was going to be a kid on the move, always seeking to be in movement, never would lay down in his crib, and then he dropped to failure to thrive, dropped off the growth charts. Yes, you did when he was 4 months old, and so that kind of set up a red flag. And through that, we have since then learned that he has autism. He's on leg braces to help strengthen his leg muscles and work through some speech challenges that he has. And then Aniston's our 2-year-old, and she was a little delayed on hitting some milestones, and since we were already working with Micah so diligently, it became on the radar, so we just threw him with therapy with Micah as well at Associates.
Wow. Victor, proud papa over here. Okay, if you would, Victor, tell everyone about, maybe about some of the challenges that you've seen your little ones overcome and how proud you are of them.
I'm very proud of both of them, just especially with the speech, and just that's something that's so obvious, you know, from coming where you could see that he had problems and issues and things that he wanted to, you know, express, and he couldn't get those out, to being able to now express those and tell you he wants to drink or he wants to watch TV. So it's come a long way because it can be really frustrating, but it's very uplifting, and they've done a lot to help us.
All right, let's talk about Team Micah and Team Aniston here because we have a team here, and they're all very proud. This is what I love about Associates in Pediatric Therapy is there's genuine compassion here. I mean, you make friends, it's relationships. So first of all, let's talk to Morgan.
Yes.
Okay, Morgan, now you are, let me get this right, you're a speech therapist,
I'm a
correct?
speech therapist.
So do you work exclusively with Aniston, or you work with Mike as well?
I work with both of them.
Okay.
Yeah.
So tell me about, let's go improvement, first of all, with the one you have in your arms with Aniston.
Well, this one, we used to not say anything, if you can believe it. Believe it or not, as we're talking up a storm today. We had a hard time just interacting with the peers appropriately and playing, and then we weren't really using any words, and we've definitely come a long way from that.
And Sarah, now you're an occupational therapist.
Yes.
Do you work with Aniston or Micah or both as well? Okay, tell me about Aniston and how she's progressing.
So like Morgan said, she wasn't talking when we started seeing her. She wasn't really interacting with toys appropriately either. So we worked on that. We just worked on structured tasks, so just following directions and doing what we asked her to do and requesting toys and stuff. So she's come along.
Yeah. I know it's great to see them progress, and I know that makes you very happy and proud. Was there like epiphany moments when you said, okay, you know, my son, my daughter, we're now really connecting now? Were there moments like that when they came back from Associates in Pediatric Therapy and you felt the progress in your heart?
There are. Now, at 3 years old, Micah only had 1 or 2 words, and so we didn't know if he was going to be able to verbally communicate. So he was pretty much nonverbal at that time. And then after going there for about a year, we tucked him into bed one night, and he just looked at me and he goes, "I love you, Mom. I love you, Dad." And that was, I would cry now because we didn't know if we would ever get to hear that.
That's
from our
fantastic.
kids.
That's fantastic. That's the kind of story I love hearing.
That's right.
So, for those who may face challenges, a little bit of an overview, if you would, please. Tell us, Caroline, about what is offered at Associates in Pediatric.
We provide speech, physical, and occupational therapy, and some mental health and behavior therapy. We also have a learning center. So we like to just be, you mentioned team. We like to be a team and be a place where parents can come, and if they do need to co-treat, they can just be at one place. They don't have to drive all over the place. And so we just want to make it, as easy on our families families as we can, and we definitely love teamwork, as you said, and we love sweet families like this, and I love hearing, you know, when those bright moments of I love you and stuff like that.
Oh.
So.
Yes.
Yeah.
I have to ask you, Victor, okay, so obviously right now, I miss this age. When my boys were this age, mine are much older now, but when they were this age, Daddy's king, isn't he?
Yeah.
Yeah, that won't last long. I'm telling you, pretty soon it's all about Mom. But
Amen.
at this age, that was the first words I think I taught my boys to say is, Daddy's what? And they go, Daddy's king. Yeah, I love that.
And I'm about to do that myself.
Yeah, teach them that. That's a good expression. So they're thriving. But if someone were talking to you and they asked, and they said, you know, do you recommend associates in pediatric therapy? How much has it helped you and your family?
It's been life-changing for us. We are there 3-4 times a week between the two kids, and it's a small community, so we walk in, our kids are playing with the other children in the waiting room, they're being greeted by Brooke at the front desk. We look forward to seeing the smiling faces with everyone, and it's just been a very life-changing experience.
It's a heartwarming story. Your kids are absolutely beautiful. Caroline,
They are.
for those, the vibe that you have there at Associates in Pediatric Therapy, can people come see? Can they?
Yes.
You invite them to come tour? If you would.
Yes, we would love, if you ever want to come visit any of our offices, we're actually getting ready to open in Bowling Green as well, so we're expanding. We love having visitors, don't we?
Yeah.
So, yeah, just give us a call, go to our website. We have obviously friendly staff, and somebody can set that up. And then, you know, if you have any questions for therapists or anything, we can take care of that too. So,
Morgan, Sarah, do you love your job?
Yes.
You do, don't you?
We get to play with these cuties.
See, that comes across. There's, you know, there's going to your job and performing a task, and then there's when you're directly involved and you feel rewarded for it. So certainly when you see them thrive as they have, you feel
Absolutely.
very good
Yes.
about what you do.
For sure.
All right, once again, Associates in Pediatric Therapy. I want to congratulate Carrie, Victor, congratulations to you. As I said, beautiful family. If you have some challenges, then I encourage you to visit Associates in Pediatric Therapy. Okay, come